Here are 4 high-yield USMLE-style questions focused on fluorescence in situ hybridization, FISH, its principles, and clinical applications. Question 1. A 5-year-old child is diagnosed with a developmental delay and autistic behaviors. A FISH analysis is performed on a sample of the child's chromosomes, and the results reveal a microdeletion at the 17p11.2 locus. Which of the following is the most likely condition associated with this finding? A. Prader-Willi syndrome, B. Angelman syndrome, C. Williams syndrome, D. DeGeorge syndrome, E. Down syndrome, D. DiGeorge syndrome. Explanation. FISH analysis is used to detect specific chromosomal deletions and duplications. A microdeletion at the 17p11.2 locus is associated with DiGeorge syndrome, a chromosomal disorder characterized by thymic hypoplasia, hypocalcemia, congenital heart defects, and developmental delay. The FISH method directly visualizes this deletion, which is not visible through conventional karyotyping. Question 2. A 45-year-old male undergoes a FISH test to diagnose the presence of chromosomal translocations associated with chronic myelogenous leukemia, CML. The test results show a translocation between chromosomes 9 and 22. Which of the following findings is most likely to be present in this patient? A. Presence of a BCR-ABL fusion gene. B. Absence of the Philadelphia chromosome. C. Presence of an extra copy of chromosome 21. D. Excessive production of tetrasomy at chromosome 5. E. Presence of trisomy 18. Answer. A. Presence of a BCR-ABL fusion gene. Explanation. The Philadelphia chromosome, a result of a translocation between chromosomes 9 and 22, is a hallmark of chronic myelogenous leukemia, CML. This translocation creates the BCR-ABL fusion gene, which produces a constitutively active tyrosine kinase, promoting the uncontrolled proliferation of hematopoietic cells. FISH can detect this translocation directly. Question 3. A 3-month-old infant presents with failure to thrive, microcephaly, and developmental delays. A FISH analysis is performed to detect microdeletions in the chromosomes. The analysis reveals no fluorescence at a specific locus on one of the chromosomes, while the other chromosome at the same locus shows normal fluorescence. Which of the following best describes this finding? A. Unbalanced translocation, B. Microdeletion, C. Trisomy, D. Duplication, E. Balanced translocation. Answer. B. Microdeletion. Explanation. In FISH analysis, the absence of fluorescence at a specific chromosomal locus compared to the normal fluorescence in the same locus on the other chromosome indicates a microdeletion. This suggests the loss of a small portion of DNA in that region, which can lead to genetic disorders like Williams syndrome, DeGeorge syndrome, or other conditions related to chromosomal microdeletions. Question 4. A 25-year-old woman undergoes a FISH test during her pregnancy to assess for potential chromosomal abnormalities in her fetus. The results show an extra copy of chromosome 21. Which of the following best describes the implications of this finding? A. The fetus likely has Down syndrome. B. The fetus likely has Turner syndrome. C. The fetus likely has Klinefelter syndrome. D. The fetus is at risk for a 5q deletion. E. The fetus likely has cystic fibrosis. Answer. A. The fetus likely has Down syndrome. Explanation. An extra copy of chromosome 21 indicates trisomy 21, which is the genetic basis for Down syndrome. FISH is used to detect aneuploidy, such as trisomy or monosomy, and can quickly identify the extra chromosome 21 in cases of Down syndrome. This condition is characterized by intellectual disability, congenital heart defects, and distinctive facial features.